Nobody gets to this point without having been through some tough stuff, and none of you in your right minds would be choosing to do this for fun. The docs think it's very important that we give you a couple of pointers before you begin, because we really do find that the couples that go into this trying to convince themselves that it's an interesting scientific adventure have a lot more trouble than the couples going into this knowing it's going to turn your life upside down, knowing that the pincushions here, the women, are not going to be on all four burners at work. You're going to be distracted and you're going to be preoccupied. And it's very important that you don't expect as much of yourself when you're at work as you normally would, that you cut yourself some slack. The people that don't know you well aren't particularly going to notice, but you're going to notice, and it's important that you remember that. Now, how many of you have been on the meds before? So you've experienced those moments when you cry over something you normally wouldn't cry about, or you get angrier at something than the situation warrants. Partners, listen up. This is going to sound very silly, but it can be very helpful. All women coming through this have moments when they cry over something that they normally wouldn't cry about, or they get angrier at you or at something than the situation warrants. They take it out on you because you're the only safe person to take it out on. It isn't about you. It feels as if it's about you, but it isn't. It's got to do with how many drugs there are on board, how logistically disruptive it is, how very important this is to you, and the fact that IVF is near the end of the line technologically. And that gives a zing that our other protocols don't have and makes for very fragile women. It doesn't mean it's not doable, and it doesn't mean it's not worth it. But 100% of the women coming through this have a lot of moments of being very emotionally fragile, and you're the only safe person to take it out on. So when she's screaming at you about something that seems ridiculous, or she's getting angry at you or crying to you about something that she normally wouldn't cry about, keep your mouth closed and give her a hug. Saying to a woman at that moment, "Don't worry, it'll all be okay," doesn't work. In fact, it accelerates it. It's very important that she knows that you're not going to run away from this extremely unattractive behavior that she knows is unattractive, but she can't stop it. She cannot stop it. Okay? So keep your mouth closed, give her a hug, and if you have to say something, tell her you love her, even if you don't love her that second because her behavior is so unattractive. How many of you have, well, let me go back to this other thing. I think that it's very important that you think very carefully about who you share this with. There are going to be a lot of people that love you dearly that are going to be calling and asking you well-meaning but probably uninformed, dumb questions. There are very few things that you have control over when you come through IVF, and that's one of the reasons it's so hard. I'd like you to take control over who you share this with and when. So before you get started, say to the people that you love, "From now on, let us bring it up. We promise we'll tell you when something big happens, but let us bring it up." Think about your day in IVF land. Think about getting up at 5:30 to schlep in here for the blood and ultrasound, getting to the blood and ultrasound and having 20 or 25 women already there ahead of you. Get the blood and ultrasound done, get back to work, pretend nothing this big is going on in your life, get back home to get the injection, dinner, go to bed early enough to start the whole thing the next day, and somebody that you love calls you and says, "Hi, how'd it go today?" You know, you may have had a snotty ultrasonographer, you may have gotten into a traffic jam you didn't anticipate. You can't, there's so many things that happen in our lives that we normally just sort of let roll off our backs. But with IVF, women are like, it's like a rubber band being pulled really tight. You just have that much less flexibility to deal with all those little things. So if you say to the people that you love, "From now on, let us bring it up. We promise we'll tell you when something big happens, but let us bring it up," that gives you more control about who to talk about it with and when. If there are hospital visits, christenings, parties, get-togethers, showers, whatever, that feel uncomfortable to go to, it's okay not to go. It doesn't mean you've become a mean-spirited person. It means that you're going through a very tough time, and it's temporary. But we really have heard again and again and again from women who say that they push themselves to go to events that feel tough. I mean, it's normal to feel envy towards other pregnant women. It's normal to feel envy sometimes with newborn babies. It's just part of the deal. It's not a permanent condition, and it doesn't mean terrible things about you. It happens all the time. But we hear again and again from women that push themselves to go and then burst into tears at the event, that's a lot harder than either not going or going for a very short, contained amount of time. Does that make sense? The hardest period of time is between, and I'm sure you've experienced this, but multiply it by around 100, is after the embryo transfer, when you're on the progesterone and you're waiting to find out if you're pregnant. And the progesterone and the HCG are going to make you feel pregnant. And it's very hard. You're going to have all the physical signs. And when you add the physical signs with all the wish, with the strong wish, it's very hard. And women often think they're pregnant and often are the most irrational and have the toughest time then. So hugs are particularly important during that time. You guys have any questions? The whole point of me is to be here for the emotional parts of this. We see men alone, women alone, couples. We have support groups. Whatever will help you get through it, because it's doable and it's worth it, but it's not easy. Okay? Why don't you follow me?